Hi, I'm Dan Pollyea. I'm a professor of medicine at the University of Colorado in the Department of Medicine and in the Division of Hematology. Next, we have the opportunity to talk about Menin inhibitors, which is a really exciting new area in our field. There are several Menin inhibitors that are being put forward in the setting of clinical trials now. And they are specifically for, so far, patients with either a KMT2A gene rearrangement or patients who have an NPM1 mutation. And the focus of this next abstract by Mirfati and colleagues really looked at the latter group. They looked at this menin inhibitor called ziftomenib in the setting of AML patients with an NPM1 mutation who were relapsed or refractory. So typically we think of NPM1 patients as having more favorable outcomes, but of course an AML favorable is still pretty poor long-term outcomes, and we need better therapies for these patients. And so this is a subgroup in the relapse setting that doesn't do very well at all, even though in the upfront setting, patients with an NPM1 mutation may have a better outcome. They presented about 20 patients with an NPM1 mutation who received 600 milligrams of ziftomenib. And again, these were all relapsed and refractory NPM1 positive AML patients. And what they found was that a complete remission rate of 7 of those patients, so 35%, was their conclusion. Adding in some of the other non-complete remission responses, the overall response rate got up all the way to 45%. There were also documented improvements in platelets and neutrophil counts, which was good to see. And there were some long-term or more durable responders as well. They did some limited MRD assessments and found that MRD negativity was a possibility in some cases, which is always a very good sign for a single agent targeted therapy. And I think the next steps that they presented with respect to this drug in combination and maybe even the upfront setting are quite promising. So the ziftomenib experience in a limited set of NPM1 positive relapse refractory AML patients certainly looks promising, with the possibility of complete remissions. Perhaps we need combination therapies to get those numbers higher. Bridging these patients to transplant when appropriate would also be appealing. And so I think the future looks pretty bright for menin inhibitors.